My name is Dr. Julius, and I will be presenting our paper, Mapping the Course to Recovery, a prospective study on the anatomic distribution of early postoperative pain after total knee arthroplasty. It's a pleasure to present this paper. These are my disclosures. None are relevant to the topic of this paper. Total knee replacement is the gold standard treatment for end-stage knee arthritis. However, as we all know, there are significant room for improvement in making the patient satisfaction and pain relief much better. Particularly when you look at the literature, 72 to 86% of our patients are satisfied with their pain relief, and only 75% to 89% of patients are overall satisfied with their total knee. And particularly within the first 3 months after surgery, 2/3 of patients have reported altered quality of sleep, quality of life, and sleep. And so there are many opportunities in total knee replacements to improve satisfaction and outcomes. Our study was a prospective observational study from January 2021 to September 21, looking at all elective total knee replacements for primary osteoarthritis. Patients were administered a question from on post-op days, pain questionnaire on post-op day 0, 2 weeks, 2 months, and 6 months postoperatively. And then we used the mixed effect model to utilize the differences in pain location and severity with post-hoc analysis. This was the pain map that we used to assess the patient's pain, and the patients were asked to essentially mark on their knee where, based on this map, where their pain was located at all those different time points. Our results showed that out of 112 cases that were collected, 69% of them were female. Their average age was 65.5 years, and the average BMI, mean BMI, was 31.9. At post-op day 0, only 6% of patients had no pain. And at 2 weeks, 22% of patients had no pain. At 2 months, that number had gone up to 47%, and at 6 months, 86% of patients had no pain. In the first 2 weeks, at post-op day 0 and 2 weeks, the patella and superior superior locations were common, and we attributed the superior to the use of tourniquet and the subsequent associated pain in the first 2 weeks after surgery. When we looked at the mean pain score, looking at the score from 0 to 10, the mean pain score decreased from an average of 5.7 to 0.7 at 6 months. So from 5.7 at post-op day 0 to 6 months, less than 1/10. Over 80% of our patients at each time point were able to specify their pain location. And the most common pain loci were patella, superior, and the medial joint line. By 6 months postoperatively, a vast majority of our patients were pain-free, specifically 86% of them. And the patient who suffered significant lasting pain did not have an identifiable cause as far as we were able to observe. There was no relationship between pain at the end of 6 months and pain scores or location on post-op day 0 or 2 weeks postoperatively. Thank you.